Brought to you by Covered California.
All right, in your health, let's talk sleep. It is a key part to staying healthy. As a new mom, I wish I had a little bit more of it these days. Joining us to talk about the specifics is Dr. Sabrina Fabi from UCSD. Dr. Fabi, thank you as always for being here.
Thanks so much for having me.
All right, sleep's something that probably most of us wish we had more of, but you're talking, there are some real specific health concerns with getting a lack of sleep. So talk to me first about the better or worse times for your body to sleep.
Well, it's interesting. In a study that was recently actually just published from Binghamton University, they took 100 university students and basically assessed them to see how their mood varied with sleep. And what they found was that those that considered themselves late nighters or people that didn't really go to bed that early actually suffered from a lot of intrusive thoughts during the day. And they're using this research to actually perhaps tailor some of the mental health disorders that we treat, because these people were more likely to have OCD-like disorders, anxiety, depression. And so there's definitely an effect possibly on mental disorder, in addition to many other things, because we've seen studies and we know that it has effects on heart disease, possibly stroke, and even obesity.
So you're talking, though, interesting listening to you, it's not, from that study with college students, it sounds like it's not just how much time they're sleeping, but the time that they go to bed.
Absolutely. So what they actually saw was that the sleep between 10 p.m. and 2 a.m. is elemental in being able to function better and not feeling so sleep deprived. What they found was that you have both more non-REM and REM-like sleep. There are two different kinds of sleep that occur mostly between the hours of 10 p.m. and 2 a.m. And so if you go to bed at 2 a.m. and you sleep, let's say 8 hours or even 9 hours, you still wake up more fatigued than if you would have had your full 8 to 9 hours between the hours of 10 and let's say 6 or 7 a.m.
Wow, that's fascinating. That was actually going to be my next question. So even if you fall asleep late, say 2 or 3 in the morning, and you feel like you get your 8 hours, that's still not as good as if you had gone to bed earlier and maybe even gotten a little bit less sleep. Talk to me, Dr. Fabi, about tips to sort of change our body clock, right? Like there's a lot of us who have different jobs that for whatever reason, maybe we're just night people who stay up later. So what are some specific things that we can do to get ourselves to sleep between that 10 and 2 a.m. time?
Waking up at the same hour every day is key, because then your body almost gets forced to start going to bed at about the same hour every night as well. And so that routine is really important. Also, with all these smartphones and tablets, trying to really take them away from the bedroom and not bring them into the bedroom with you, because that light is quite stimulating. So it may actually keep you up later than you need to at night. So reading a good old-fashioned book without that light may be more helpful. And then the obvious, not drinking caffeine after 12 noon, because that caffeine will keep one up longer than they need to be.
Wow, not drinking afternoon. And here's some tips that we're putting up on your screen. Real quick, Dr. Fabi, what is your argument to those people who say, you know what, I don't buy it, I'm fine with just 5 or 6 hours of sleep?
I would discourage them. There's just too many studies that are coming out telling us otherwise. There was actually this very interesting study in the Chinese medicine literature that even started correlating sleep times with the regenerative capacity of different organs. So let's say from 11 p.m. to 1 a.m. the gallbladder regenerates, and from 1 to 3 a.m. the liver regenerates. And so there is something about really getting all those hours of sleep and having really no sleep interruptions during that time.
All right, you've convinced me, Dr. Fabi. Thanks so much. Appreciate it.
Best of luck with your sleep, Jen.
Yes, I am all for it. The more I can get, the better. Thanks, Dr. Fabi. Well, Sam